So I look forward to you sort of engaging with that. Thank you. So the first one that Mark has kindly put up relates just to why recognising complexity is important, I think. So that idea that, contrary to popular belief, it is very, very hard to control variables. If we look back to traditionally studying parts of systems, what we look at are what we tend to gravitate towards is particular aspects of a system. So the people, or you look at the intervention, or you'll focus on the outcomes and see all these as distinct variables. And the other thing that we do, I think, is assume that those variables, that we know they influence each other, but that influence is really straightforward and that we can make sense of that influence and it's knowable. In designing interventions in this way, what I think happens is what we're looking to do is get that sense making, and it's quite what we're doing is we aim for reduction and control, and what we look to do when we're trying to make sense is sort of remove confounding variables, etc., to try and get to that sense making. And that's kind of a sort of more traditional way of trying to understand systems. Is we extrapolate and certain variables so we can make sense and test others. I guess in complexity science, one of the key things I would say is that whilst the components of the system, so the individuals involved, the interventions, etc., are really important, I think one of the first things that complexity theorists would say is that they're often secondary to the relationship between the component parts. That's the bit that we actually need to be paying more attention to. Trying to bring that to life a little bit, I think when we create an intervention, and I use the word intervention in the broadest sense, whether it's a medicine, a type of training, somebody coming with a change idea. So think about intervention really broadly. When we create an intervention, we focus on building often a robust evidence base around it. So what we're trying to do is prove that what we want to do is or will be effective. And that's why we have with RCTs and things, they try and control variables or remove variables because they want to demonstrate that impact. But these interventions don't in reality play out in those conditions. They're going to be used in messy, complex systems. And often what we don't do is factor in that reality. So what we need to start doing is accept that we can't control those variables in real life and think about how that intervention is going to relate and engage with different layers of the system over time. So if the focus is not on us being able to say whether this intervention works or not, what we need to start doing is thinking about how this intervention might work effectively in a particular setting, because our reality, as I'm sure you are all very well aware of, is that trying to control and isolate variables in real life settings is a really tricky thing to do. So that would be kind of my starter for 10. If we move on to the next slide, Mark. The next thing I was thinking about when thinking about complexity is this idea that we need to embrace what I've called the adaptive reality. So if we're looking at something through a complexity lens, what you often hear if you read about, or if you've been sort of reading around kind of complexity literature, is this idea that we have complex adaptive systems, and systems are adaptive. They don't stand still, they change over time. And they also have multiple components. So these adaptive realities are constantly changing and have multiple components that interact with each other, and often in a really non-linear fashion. And that's why it can be really hard to control these variables. So the other, I guess, outcome of that is that they produce unpredictable behaviours. And also something else key that I'll come on to links with the next point is this idea around also they produce unobserved outcomes. So the actions are often really interconnected. So I guess what I'm trying to say is the actions of one person can change the context for another one. And this happens across our worlds, really. If you can think about it in relation to our body and the immune system, you can think about somebody's reactions changing somebody else's context. If you think about something like the financial markets, or more related to health and social care, think about it in relation to when you're having sort of commissioning meetings. So this makes me think about how we approach change, I guess, and how we have to hold this idea of complex adaptive systems really front and centre when we are engaging with our work. And I came into this thinking through my PhD. So my PhD is about looking at complex interventions and how we implement and sustain those in a real world setting. And where you get to with the literature, and I'm trying to use this as an example to sort of highlight the point, is that we will talk about barriers and facilitators. And you all have read lots of literature on this and what are the facilitators to implementing change or implementing a new innovation, etc. And we'll have things like people will say, well, good leadership, we have evidence to show you that good leadership it will be a real facilitator. But my stance, and I guess where I was coming from in the PhD, thinking about these complex adaptive systems, is that leadership isn't happening in a vacuum. It doesn't happen in isolation. You can't control that as a variable. It doesn't stand alone. That leadership as a facilitator will be interacting with other facilitators. It will be interacting with some of those barriers. So what we need to do to be able to sort of move this area on is really think about the relationships between those actions and these determinants, and think about how they connect. Because these shopping lists are really kind of helpful as a starting point to think about your system and how many of these facilitators do we have, how many of these barriers are in our organisation. But you need to look at how they work together, because none of them sit in isolation. So that will be my second point. Embrace these complex adaptive systems and this adaptive reality that we do live in. If we move on to statement 3, I was really worried when I wrote this because I was thinking I sound like Donald Trump or something talking about alternative truths. But it's not what I mean when I say there are layers of reality. I think it's really important to sort of just say that I come at complexity from a realist perspective, which is another conversation entirely. But suffice to say, a realism really embraces the notion of complexity, and a realist approach provides a systematic way to explore context and complexity together. So what it does is, I guess the sort of the shortcut analogy is often if somebody's what we do is go, what we need to prove is that A plus B equals C. And that's often the questions that we're asking kind of in health research, etc. If you're taking a realist approach, that's not the thing you're interested in. You're not interested in, does A plus B equal C? What you're interested in is how, why does A plus C equal B? Does it do it for everybody or for whom, in what circumstances? So it's asking those sort of tricky questions, I guess. And as I said, it's another conversation in its own right, but from a realist perspective, I kind of think to look at any sort of systems thinking, we have to embrace this idea of what Justin Jagos, who is one of the sort of key figures in realism, talks about in terms of ontological depth. And by that I mean, that's what I mean by layers of reality. So the analogy that's often used is this idea of an iceberg. So we have a reality that is observable, that we can see, and that is real and we can see it. From a realist perspective, they would also argue that there is a reality that we don't see, that's kind of under the surface, that part of the iceberg that is hidden. And I think that's really important to think about when we're thinking about complexity and understanding and sort of making decisions and approaches within health and social care, that often we look at the observable, but there is also the hidden, and how do we understand the hidden? But also not just the hidden, but, and again, this is very much chimes with complexity, the latent as well, that which hasn't yet happened. So there's something about thinking about reality not just as what we can observe, but also what might be hidden and is kind of yet to come, or hasn't started yet. So this idea about thinking about layers of reality and these about generative causation as well. So this assumption that there, in realism, we think about hidden mechanisms that are responsible for those observable outcomes. So we'll have an outcome that we can see, but what has caused that outcome we may not have seen. So this idea around hidden mechanisms. And if we want to understand the true impact of something, of an intervention in the broadest sense of the word, then we have to embrace complexity, because circumstances and programs are complex. And I think the other key thing that we need to keep mentioning is that they're rapidly changing. And I think by using complexity theory, we can create, I guess, a vision of how these programs or interventions unfold in the complex environments that we work in, and look at that over time. And the idea of being able to do that, however hard it is, and I appreciate it is really, really hard, is that on some level that we can start to develop some kind of foresight and look at how we can leverage programs or interventions or aspects of them to be able to deal with the complex problems that we're trying to manage. So yeah, the key thing there is thinking about reality, think about the iceberg and the layers of reality that we might have to engage with. And the final one is, I guess it's this idea that we have to, if you are somebody that accepts some of the aspects of complexity theory when you're thinking about your systems and things, that we have to lean in to the discomfort and frustration that will inevitably foster in us, I guess. One of the people that, if anybody's interested in learning more about complexity, there's a guy in Australia whose surname is Braithwaite, and I can't remember his first name, even though I've read tons of his papers. I'll remember it. But he says that he thinks complexity thinking adds a real world, as I've said, kind of multi-dimensional appreciation of the system, both its density and its dynamics, but has a caveat that doesn't, just because we understand it does not make it easier to affect change. And I think this is the real challenge, because in fact it does the opposite. I think the more that you sort of embrace and get curious about complexity and complex systems thinking, the more you unpack. So actually there can be a real challenge in that. So it isn't that if we understand it, it will then be easy to affect change. That isn't the case. But there is, I think, something quite interesting about what can happen if we can lean into that discomfort and start to really genuinely tussle with these ideas. And I appreciate that the problem with that is that it requires a lot of headspace. And I think the challenge that we have in health and social care is, and lots of other areas of work, is that we aren't afforded that headspace. So I think even though it makes our ambitions to improve healthcare and social care really more difficult, and it can feel infuriating, I think we have to grapple with it, because as Braithwaite says, we've got to think about how we deal with the world we actually inhabit and not the one that we wish we did. So if we want to make changes, I think we just got to stick with it. And I think the challenge has been we've shied away from that for too long, because we naturally, I think sometimes as humans as well, want to sort of try and sense make and simplify things. So often if I get asked kind of the question as to why look at complexity, why is it significant? The really short answer is because it is our reality. There's a really other interesting paper that talks about it, as David Berish, I think his name is, and he talks about it, thinking about how you have high levels of social complexity and then high levels of system complexity. And he basically says that when you have high levels that way and high levels of both, you end up in this place of the Badlands, and that we sit in this sort of really tricky terrain is coined it as the Badlands, but that's a terrain that we actually sit in, because we do work in a world where there is high social complexity but also high system complexity. So we have to accept that. It would be really lovely if we lived in kind of the clockwork universe that kind of Newton talks about, where you have big problems and you can break them down into smaller ones and solve them through rational deduction. But I think the machine metaphor does let us down, even though it's been one that we've used for many, many years, because no part of the machine, if you want to try and use the analogy, is constant. They're unpredictable, and so it is just about trying to, at risk of repeating myself, just sort of embrace that this is the world that we are in, and we need to try and keep tussling with it. I think treating organisations as complex adaptive systems actually does allow for new and more productive management styles. Having just said, I appreciate how challenging it is, but I think the problem that we have is that in doing that and embracing ideas around complexity, the challenge is that it challenges some of us as sort of managers, senior clinicians, leaders, etc. It challenges some of our constructs that we often feel that we need to have the answer. So I think it is about changing a culture around that as well. And actually, I'd be really excited to see kind of what unfurls, because I do think that it could really have an influence on kind of the management styles within health and social care and how we influence change. So that would be my opening gambit, I guess. To hopefully some of that has kind of stimulated some thought and some questions that you want to ask. But thank you for letting me chat at you for a moment. I'll hand back over to you, Mark.
Thank you. That was a clearing of my throat. That wasn't a kind of reeling back. Thank you, Carrie-Ann. I thought that was stunningly good in terms of giving us a kind of insight into complexity, but also the sort of conversation we might have about it. So if people have questions, specific questions or ideas they want to share as part of this conversation, then please use the chat box, because I'm sure just that 15-minute introduction will have sparked quite a lot of things for people in the audience, and I don't want to lose that. I don't want it to shut that off. I'm going to pick up on where you finished, really, because I thought, as I was listening to the presentation, I was thinking it was taking me in a particular direction where I was thinking, ooh, that's becoming more and more uncomfortable in some senses. So and just thinking about the context in which we work, so I jotted down 3 words, which are probably the watchwords for the way in which we manage or try to lead in the health service, particularly at the moment. Which is, we're always looking for some kind of certainty. We're always looking for a knowability, and we're very often looking for a cause and effect which can be measurable. And it struck me that if those 3 things are, part of the discourse of management and leadership that we currently have in health and social care, how would we get to somewhere different? Do you have any sense of where the baby steps might be to start to nudge us away from where we presently are to a position where we can embrace that kind of picture of complexity?
Gosh, yeah, I'm just thinking where to start. I think there is something. So I hope that this feels kind of relevant. So I'm going to just reflect back a little bit on my PhD subject, which is sustainability. And I have a particular way of looking at sustainability, which you will see is very much informed by complexity, in that sustainability is actually not, and it's again my thought, and I think there are some people that would very much challenge me on it. Sustainability, I don't believe, is an outcome. I actually think it is a process, and that it's a dynamic process that adapts over time. And actually, I think the only thing that is constant is change. So there is something for me about being able to, and I think it can be, it's really careful, because I don't want this to sound like it makes everything a free for all and it's okay to go, well, I just don't know. But I think, because that isn't my intention, I think that there is something about being able to accept that some things will remain unknowable to a degree. And I think that's a big ask, as I was saying at the end of the presentation, because that really pushes some of our buttons and challenges some of our constructs about the way in which we manage and lead. And I think, I guess the other thing that kind of comes to mind, I guess, is just thinking about, I guess, think about how you think about outcomes, I think, because some outcomes can remain invisible, because mechanisms and things will activate over time. And if you're thinking about kind of complexity, there's very much something about how we think about things that change and evolve over time. So I guess that a baby step for me would be to think about outcomes. Try and start at the beginning by thinking about outcomes at different time points, and also think about outcomes that you might not actually know. So you can get those sort of unintended outcomes, and it's about coming back to those. I think we're asking us to have conversations in really different ways, and by no means is that easy. The last thing I'll just say on that point is, or try and elaborate on, I guess, is if you think about it as a dynamic process, any sort of change that you're trying to influence, and thinking about that as big changes or little changes, if you think about it as a dynamic process, causation will can happen at one level of a system, and it can generate outcomes at another level. So it's thinking about when you're having those conversations, start trying to think about where the outcomes can happen kind of across a system, and what might be the implications. And I guess tangible ways of then thinking about that is thinking about kind of how does that impact how you implement your change, in terms of the dosage or the dimmer switch analogy, when you're introducing change or a new intervention. And so I would say it's about reviewing that to the change. And I would say, even if we start to think about the content of the process and the architecture of the process as much as we do about the content, then that's a really, really good starting point, because I do appreciate that looking at this topic area, you can really go down a rabbit hole. I hope some of that made some sense.
Yeah, no, thank you. One of our guests today, Mark, has kind of, I'm not going to immediately throw this question at you, so don't feel obliged to create an answer instantly. Okay. But how would you commission something that is unknowable? And whilst you gather your thoughts in that respect, I know it's a kind of master's level exam question, I think. So, but I think, as you were talking there, I was reminded of a number of phrases, and particularly stuff about destination and journey. So I think a lot of the planning that we try and do in corporate settings, and that's in the health service and beyond, is quite hubristic. It's always going to trip us up in many ways, because the planning fails to take into account the complexity in which we're working. Just as you said, the complexity of life means that the outcome that we anticipate is we may deliver on that, but it's more likely that we'll deliver outcomes that were unexpected, but nevertheless are beneficial. And I guess that the phrase that sprang to my mind is that we don't see what we're not looking for. And that's very often the case with a plan, particularly the project plan. We say, well, we're starting X date, and by Y date this will have happened. And if it doesn't happen, we all get beaten up, because everyone says that project failed, he didn't deliver. you get people creating a fictional reality, which is actually, I'll just flip this box from red to green and everyone will be content. So it strikes me that reframing that kind of thinking would be really useful in terms of identifying things that were coming out that we didn't anticipate, and focusing out on the outcomes we're getting. So it goes to Dave Snowden's point about how many safe to fail experiments can you generate, and where do they deliver on it. So is there something, having done that preamble to give you some breathing space, not terribly well, I'm sure, is there something you might want to contribute in terms of thinking about the practicalities of something like commissioning service and trying to do it through the prism of complexity?
I think I think it's a really great question, and I would love to know what my answer would be in a couple of days, having kind of ruminated on it a bit, but I can share my initial response. And I think there is something, I think that's where, as I said, I look at complexity from a realist perspective. And so I think there is something about understanding what works, that idea about what works for whom and why in what context, and being able to, and you can do this sort of systematically and to a degree and transparently, go with the risk of a cliche, kind of, I guess it might make us think differently about kind of what we're commissioning in terms of, I guess, what we're calling it, because you could be going on a journey, so to speak, with a particular sort of intervention that has certain kind of review points, etc., where you're going, or you're doing a piece of research before even commissioning it. So you're doing like a sort of almost like some sort of kind of pilot study where you're going, we're really curious about commissioning this in this context, but what we really need to do is do some sense making about how this would work in this context, because this idea that you can develop I believe that you can't develop an innovation or an intervention outside its context and then say this is generalizable everywhere. You'll all know, so I've done work with some of the commissioning projects for that nurses and health visitors were doing a few years ago. The same project looked completely different in different places. They could still have different but appropriate and good outcomes and have impact, but they looked different. And I just think by using a lens of to have a slightly different conversation about that journey of implementing something. I don't by any means think that you can go, we want to necessarily, I might change my mind on that, but go, somebody, can you hand over, £500,000 for something, and we don't exactly know what will happen at the end at all. But I just think complexity, looking at it with a complexity lens, helps us maybe just ask some different kind of questions at the outset, and maybe challenge some of the constructs that we have around how we sort of we manage that the pathway of that kind of that intervention. It's that challenging that pipeline analogy that I was talking about, or that before. I don't think that that's necessarily always helpful, and I think sometimes when we commission things, we do go on that pipeline or train track kind of sort of analogy, and actually thing that I think we need to sort of challenge, because there is a lot of unknown, and I think, as you said, unknown makes people nervous, but let's unpick what that's about and think about it a little bit more.
That's it's fascinating, because I was just thinking about the critique of pilots, which we do a lot of in the NHS. We are terribly excited about pilots, and again, Dave Snowden's observation about pilots is that, first of all, a pilot is a privileged thing, so it gets lots of resources, lots of focus, so it's inevitably going to deliver quite well. And then there's a sense that you can lift and shift this and get exactly the same results in a different context. And I think the way in which you've described kind of complexity with the variables of play and the way in which they interrelate strikes me as a kind of kaleidoscope analogy, that constant shifting of a pattern, which makes it very difficult then to say, well, if I lift this from one area and put it in another, I'll get the same outcome, because that's not necessarily the case. And so we either get terribly enthused about pilots and senior leaders say, well, we should lift this pilot from here to here, or we get quite defensive about it and say, actually, it's not designed here, so we're not interested in it, which is always quite interesting. So I thought your take on just thinking creatively about you're not going to get the same outcomes necessarily because the context has changed and the relational structures around that have changed, but you will get outcomes if you're alert to them. So I thought that was, sorry, go on.
No, I think you put it really, really nicely, Mark. There's something about it's embracing, to me, sort of how dynamic these processes are, and being open to some of the. So I guess one of the things I was thinking about when you were just talking then is this idea in complexity theory around they believe that sort of major system change happen through I think the word they use is bifurcation or something, which I can't say, but an easy way of saying it is the tipping point process. So in complexity, they talk about a tipping point, where a point of change that a system is going to make, at that point of change, they oscillate between some different trajectories, and there's this before they make a decision which one to go down. And the key point that they make is these options, these choice pathways that they're looking at, the system is looking at when it's oscillating. The difference between each of them is made of really small differences, and differences really sometimes really slight differences in the context or the controlling parameter. And that's what I mean about maybe having, and I don't think we can become fortune tellers. We can't necessarily predict, and that's the point about how these small differences will impact on choices. But I think we can have some really curious conversations about what some of those tipping points could potentially be. And I think the problem is that these are really tricky conversations to have, and they can feel quite up there sometimes, and it isn't comfortable. So but I wonder what a world would be like if we were going to embrace that a bit more. And I genuinely think that we'd have that it could offer some really exciting differences in the way in which we lead systems.
Just thinking about systems, Paul has helpfully offered us a picture. So he's asking whether, as a model of health and social care in the UK as a complex adaptive system, is there some way of conceptualizing it? And he's described it. I think he's answered his own question, because he says it seems like trying to drive a car when other people are controlling the car and not talking to each other. And that's, I do quite a lot of work with ICS, and that really did quite resonate with me. So I wonder if there's kind of observation about modelling, and whether that's a way of thinking about it and a way of getting to a point where one might think differently. And similarly, Margaret, in terms of our baby steps, has asked the question about whether, in terms of looking at projects, if we moved away from the kind of waterfall model to a slightly more agile approach, what your view about that would be in terms of a step towards embracing this kind of very all-encompassing complexity vision.
Yeah, I think that's I really like that. For me, what that idea about sort of more agile kind of conjures up. So I think that would it would be a fantastic starting point. I think if we can sort of switch the lens, some conversations, think about it in that sort of way, you're saying sort of more agile, more adaptive, thinking about if we can start to just sort of say this is a complex system, and we know that there's stuff we aren't going to know, that would be a brilliant starting point. I think, and what we're talking about, some of the stuff I've talked about today, saying it is some very different ways of thinking, and it might, it requires potentially some quite sort of seismic changes. But I think anything that gets us to start thinking or approaching things in a slightly different way. So that's a really long-winded way of saying yes.
I was going to follow up that I was fortunate enough to talk to some people the other week. It's a charity based in Nottingham, and they'd ended up working with Nottingham Trent University on a piece of research. And the charity supports employment opportunities for people, and had a very narrow view of what that meant. As you would do as a service provider, you tend to get stuck in a routine, a particular way of thinking. Your metrics tend to determine the way in which you think about what you might deliver. And they got to a point where they thought they weren't convinced they were delivering exactly what their constituency wanted. And so they kicked around the idea of, shall we just do a survey, as you would expect. And in the end, they got Nottingham Trent to work with them to train people in the community and to pay them to be participatory action researchers. So those people were in the community, talking to the community, and what came back from that exercise was a completely different perspective on what needed to be done to support people. So, the charity's view was, let's just expand the number of employment opportunities there are, because that will be better for the people we're trying to serve. And the message came back, because they'd actually invited voice in slightly differently, the message came back really powerfully. Actually, with the gig economy, we don't want more employment opportunities. We want secure employment opportunities. And they wouldn't have heard that if they hadn't had that conversation. And so to go back to that commissioning example and thinking about the way in which we very often as a health service think about and deliver service, despite what we might say about co-design and participants being involved and such like, and service user involvement, it struck me as a really important way of thinking about it slightly differently, to actually just engage differently with an open mind, which probably acknowledges that the linearity that seemed to underline the standard model of practice that charity had no longer served them well, and they needed to think slightly more obliquely. So I thought I'd just share that for a moment. The other one I was thinking about was the asthma example, which I think comes from Virginia, where lots of people coming through the ED with terrible asthma attacks, they're treated as acute instance, then they're discharged, and eventually the providers said, let's look at the people that are regularly being admitted through the ED for asthma, and go to their homes and check what's going on. And of course, as soon as they went to the homes, that's where they found the mold, the carpeting, the poor quality furnishings that needed to be ripped out, and very often very bad quality housing. And so there was a slightly more oblique approach to it. So I wondered, this is a long preamble to get you to a point where I would invite you to make any comments you have about how you thought about complexity in respect to your work as a mental health nurse. So how has complexity informed the way you think about interventions in terms of mental health?
I think the first thing that comes to mind is this idea around these kind of invisible mechanisms and unseen outcomes, and outcomes that happen at a different level of the system than the one in where that decision was made, and thinking about sort of almost like kind of parallel processes. So when I used to do a lot of work with in social care departments and with social workers, and we would talk about this idea of parallel processes, and that you would have, if you had a manager, because these guys were supervisors, and they gave their supervisors a particular experience, positive experience, where they felt listened to and heard, etc., that there would be a ripple effect there, and that then when those family workers, social workers went and worked with the families, that would enable that parent to they would do that with that parent, and empowering that parent, have a particular type of conversation they feel listened to and heard. So their parent would experience that, and this ripple effect, then that the parent would do that with the child. And they would look at that little sort of section of the system and look at this potential ripple effect. And I would say you have the director of services at the top, and they never see that child. They will never see that child. But don't tell me that the actions and the way in which they are in the world and their organisation and environment can't have an influence on that child, because it can, because of this kind of idea around sort of this ripple effect and what happens through a system. So there's something for me about, I guess that was just the first thing that came to mind, about thinking about what happens at certain levels of a system and its potential kind of implications, either over time or at a different level of the system, and just starting to just get curious and think. I think that's the thing for me. It's about getting curious, and it is, I completely hold my hands up, affording the headspace to have those kind of curious conversations, which I don't think we get the chance to do. But yeah, that was my first, that just popped into my head. I don't know why, but
that's excellent. Thank you, Carrie-Ann. I'm just checking to make sure I'm not going to miss anything as we draw towards a close. I think that's a comment. Ali has made a comment on that, which I think is interesting and will be part of the chat. Paul, and this will need to be a brief answer. I think Paul again has argued about is it unknowability, or is it very often the case that it's I want to say knowledge hoarding, but I don't think that's what Paul is talking about. But the failure of the relations to communicate various elements of the overall complex system. So just in a minute or so, I wonder if you had any thoughts about whether it's complex unknowability from a strict complexity perspective, or whether there's something about individual human agents relationally not sharing stuff, or is that actually just a facet of a complex adaptive system?
Again, my initial response would be that I think that we are all that kind of top complexity that you talk about, individuals as kind of actors kind of within a system. And I guess my initial thinking around that is that's a really nice example of the complexity of a system, in the sense that that's what I was saying before about kind of these tipping points and decisions that were made. The fact that somebody chooses not to share certain information has ramifications and can change the context in the way in which somebody else receives something. So it's part of that messiness. That's kind of my first. I don't know. My other thought is, can it be both, sort of thing? But I haven't formulated an opinion on that. But I do think that the way in which we manage knowledge is part of that complexity, because the complexity is it boils down to kind of human actors and our relationships with each other and artifacts and things like that. So I'm just going to go down a rabbit hole, but I won't.
Okay. Well, with just a few minutes left, Carrie, we talked about offering you 5 minutes as a kind of closing set of remarks, but if you can compress that slightly, that would be helpful. So just a closing statement in about 4 minutes. Yeah, I know.
Yeah, that's tricky. I think, I don't know, I think I guess my closing statement is a bit similar to kind of sort of my starting point in the sense that this is a massive subject, but I'm quite a pragmatist, and but also a theory junkie, I guess. It's something I'm really interested in, kind of sort of the use of theory, and that's with a big T and a little t as well. But I'm also a pragmatist, and I think for me, what's really important with any of these conversations is that we look at how it can have impacts, you know, in a small level on real life practice and real life working. So I guess my closing comment is get more of an invitation to people to take some time, I guess, to reflect and get a little curious about some of the things we thought about, and you will know you'll know so much more than I do about how anything that we've spoken about kind of resonates for you and your systems. So I think my closing thing is more of a invitation for people to think about if there are any nuggets of the conversation today or anything it's triggered for them, and think about how that then applies in their practice and their real world setting, and go agile, as somebody said earlier.
That's fantastic. Carrie-Ann, can I say thank you very much, firstly for your time today, and secondly for setting out what is, not to make too big a pun of it, a complex topic, but actually to ground it in practice. And I think you're right, it is a challenge. It's a really challenging way of seeing the world when we're so entrained to see the world in a particular way. So we'll probably all leave this meeting and go into situations which are so far removed from the vision that you've just described. Even though complexity underlies that, we will go back into situations where we're trying to create certainty, trying to exercise control over a situation which is, you know, enormous number of variables all relationally interacting with each other. So I think it's really useful. I think your challenge about let's carry this away and think creatively about it in our day-to-day practice is really important, because I think the other thing I think about complexity is it does work at that quite meta level, but it's also really important to see it at a local level about what you do individually and how you might rethink the stuff you do, and that in itself will have an impact in the way you've described, that rippling effect. And I guess that I was reminded as we were talking about the work of Robert Cheer and others who talk about organizational change and organizations. And his observation is that change is the perfectly normal situation, the unknowability of organizational life, and organization is the artificial state that we try to impose on the world. So it's recognizing that change isn't a grand plan we put together or something we try and visit on people. It's the ebb and flow of day-to-day corporate life that we have to try and make sense of as we go through our practice. So I think that's fabulous. I hope others on the call have found as much as I have to take away from that conversation, because I think it was fascinating and it's really given me a huge amount to go and think about. I hope that's been a useful hour for you to spend, because I'm aware how precious time is for all of us presently. So I do really hope that has been a useful hour. And if it has, I remind you that next week we still have places, of course, because, well, it's virtual, so we can have as many people as we like. We still have places with Will Thomas to look at wicked problems, which will build very, very clearly on Carrie-Ann's work and her discussion today. And thereafter, we have Ali to talk about systemic leadership. So if you're not registered for those and you found today interesting and think they might be insightful for you, please go back on the website and book for yourselves. And other than that, thank you very much again for your time, and I hope it's been useful. Thank you, everybody.
Thank you.
Oh. Can you hear me?
Yeah.
Oh, I just wanted to say a quick thank you because I'm about